Hey, it's Dr. Duke, owner and chiropractor at Circle Chiropractic. Have you ever had an MRI and the doctor really just didn't explain it to you, or you got the report and you had no idea what the words meant? Well, this video is going to try to help you out a little bit. I have a lumbar MRI right here, and so when you think about MRIs, they're like cross sections. They're cutting it in this pattern right here on the body. And so what we have right here is to demonstrate the most central cut, which is going to give us the best and most information. They did a really good job of actually diagramming the lumbar spine. So you have the sacrum down here, then you have L5, 4, 3, 2, 1, that makes up the lower back right here, and they even added T12. So now I have the report here that kind of talks about the findings. So a report is read by a radiologist, and that's literally their profession, is to be able to read these types of images. And so I just cut right to the impressions. The impressions is like the summary, all right? So you want to kind of know all the basic summary points, and they usually list them in order of importance. So like number one is like the most important, and it goes on down the list. So with number one, they spend a lot of time talking about this, and I'll try to unpack it and talk about posterior left paracentral extruded type disc herniation L4 or L5 S1. My goodness, what does that mean? Well, in simple terms, the extrusion means the type of severity of the disc herniation that's happening. You have a protrusion, then you have an extrusion. An extrusion means that we're actually pushing more back into the spinal cord structure right here, and now you can see this big hump formation. Now what it's supposed to look like is nice and smooth right here. You don't want to see any dents in the spinal cord. The spinal cord is this white material that runs right behind the bones, the discs, you get the idea. So when we start to see these little bumps right here, now we start to get concerned, and we can actually see it at multiple levels. Number one is just accenting that L5 S1 disc extrusion. And it actually says that approximately 4 millimeters of diameter is happening into that spinal cord. It also talks about the extruded structures going into and creating something called stenosis. Stenosis is a term that means narrowing. And again, we're talking about narrowing the spinal cord. There are two types of stenosis. There is central stenosis, which is talking about the spinal cord, and then there is foraminal stenosis. Foraminal stenosis is narrowing of the spinal nerve roots. These little canals that come out the right and the left side of the spine. What does that mean? Well, your spinal cord is connected to your brain, so we call your spinal cord your long brain. Then it comes out these spinal nerve roots, and it innervates or it connects to every organ system, every muscle tissue, every single cell in your body is controlled by these nerves. So in this level, unfortunately, they have central stenosis, so it's putting pressure on the spinal cord, and they have bilateral foraminal stenosis, which means both nerve roots at the L5 level are affected, which makes a lot of sense because this person has sciatica in both legs going down. Number two is that there is a disc bulge at L4, L5. So if we go up one level from L5 to L4, there's a disc bulge here. What's the difference? It means that they say that this is extruded, this is more aggressive than this disc bulge at L4. It also says that there's foraminal stenosis on the right side. So that means that the spinal nerve root on the right, that canal is closing and putting pressure on that nerve root. When we go to number three, bulging disc at L3, L4. So again, they're just kind of going up the list. And this is very common. Most of the time we see a lot of the destruction happening at the bottom because everything kind of weight and gravity loads at the bottom, and then it kind of surfaces back up. So most of the damage that we see here is typically at the lower levels. Oh, this is a good term that we haven't talked about this yet. Bilateral facet arthropathy. Okay, well, we have these facet joints in the back here. We call these posterior structures because they're in the back. If you've ever felt your spine, you can feel these bony structures. They're called your spinous processes, okay? You got your discs in the front. Everybody knows those. They think that that's the only joint in the spine, but there's actually joints right here and little discs in your facets, and that allows your spine to flex back and forth like this. Arthropathy means that these are inflamed, potentially swollen, worn down, some wear and tear. That's what it's describing. A lot of people, when they have a hard time standing for long periods of time, it's because they have facet arthropathy. Mild stenosis of the right and left foramen. Stenosis at both levels, bilateral. Again, not just at L5, but L4. And then they say that there's a slight retrolisthesis. Now we're getting into some crazy terms here. At L3 is the retrolisthesis, okay? They're talking about this bone right here. What that typically means is if you line up the back of L4 and you keep going, it should line up all the way. What they're saying is L3 actually shoots backwards just a little bit, and it's creating a retrolisthesis. That slippage of the bone is going back into the spinal cord a little bit. It's very, very small and minor, but the radiologist did pick it out. Now, why is that a big deal? Well, that's showing us that that's starting to become an unstable joint because the bone is slipping on the disc. Number 4, disc bulge, lower thoracic spine, T11, T12, L1, L2. So they did a really good job, because a lot of times radiologists will only stick to the script. This radiologist actually went above and beyond, and now they're talking a little bit more about the thoracic spine, which we call the mid-back. So if you look at that right here, they're talking about some disc bulges at these levels right here. Now again, they're not as major as these, they're just bulges, and people walk around with bulges all the time and don't know it. Number 5 is Schmorl's nodes. Again, another amazing term that people just have no idea what it is. A Schmorl's node identifies that there's actually a disc bulge or herniation happening in a different direction. What does that mean? Instead of the bulge going back or forward, if you look at this little dent right here, the disc is actually going up and penetrating into the bone right here. This is a very, very chronic disc condition. That means that we've created a weakness in the bony structure, and the disc is actually pushing back into that. Last but not least, we have atrophy of some of the posterior paraspinal musculature of the lower lumbar spine. Well, goodness, that makes a lot of sense that we'd have some atrophy in the muscle tissue if the joints are becoming weaker and degenerative, and we're having improper nerve flow because we have central and foraminal stenosis. How do muscles get their impulse control? How do they stay strong? The nervous system. The nervous system controls the muscular system. So if we have this compression of nerve roots happening for extended periods of time, what we will often see is there's some atrophy in the muscle tissue, which is detrimental because we're causing weakness, more and more weakness in that area. So what do we do at Circle Chiropractic? It's very, very simple. It depends on the severity, whether we have to refer a patient out or if we can treat them with our therapies. In this situation, this is a perfect candidate for a lot of the things that we do. Most importantly, spinal decompression therapy. We take on a lot of complex cases here because there's a lot of chiropractors in the area that just don't have or are not equipped with the technology that we are here. We are lucky to be able to do that. So we take on a lot of disc condition patients. And so this person is in the right place, and we will be able to help them. I hope you enjoyed this. This is a different type of video. If you like this and would like me to deep dive a little bit more, or if you even have an MRI that you'd like me to read, just send it to us, and we'll see you soon.